Sleep is an essential factor that helps us maintain our health and energy every day. However, for the elderly, some incorrect sleep habits can become silent killers, severely affecting both physical and mental health. Over the years, many elderly people have suffered from serious health issues, even death, simply due to seemingly harmless sleep habits. Let's explore 7 common sleep habits that silently destroy the health of older adults and find out how to effectively prevent them so you and your loved ones can maintain a peaceful and healthier sleep. Sleep posture and the risk of stroke and sleep apnea. Sleep posture is the first factor to consider when evaluating the sleep of older adults. Many studies have shown that sleeping on the back or sleeping on the right side can increase the risk of developing several serious conditions, including stroke and sleep apnea. Sleeping on the back increases pressure on vital organs in the body, including the heart and lungs. This pressure can impair proper blood circulation, leading to oxygen deficiency, especially if the elderly person has existing cardiovascular or circulatory issues. When sleeping on the right side, the aorta and major organs in the body may be compressed, disrupting blood circulation and creating cardiovascular issues. This increases the risk of health complications such as stroke or sleep apnea, a condition where breathing is interrupted during sleep. Sleep apnea occurs when the respiratory organs become blocked during sleep, leading to oxygen deficiency and posing risks to cardiovascular and brain health. Best sleep posture for older adults. Sleeping on the left side. The best sleep posture for the elderly is sleeping on the left side. This position not only helps older adults enjoy a better night's sleep, but also offers many health benefits. Sleeping on the left side helps reduce pressure on the heart, facilitating blood circulation. Specifically, this posture helps improve blood flow from the heart, allowing it to pump blood more effectively and reducing blood pressure issues, thus decreasing the risk of dangerous heart diseases. In addition, sleeping on the left side also reduces the risk of acid reflux. Acid reflux occurs when stomach acid is pushed up into the esophagus, causing a burning sensation and potentially leading to serious digestive issues. When older adults sleep on the left side, the stomach is positioned lower than the esophagus, reducing the risk of stomach acid reflux and causing discomfort or damage to the esophagus. Solutions for improving sleep. To maintain the left side sleeping position easily and comfortably, elderly individuals can use several supportive solutions. Using a supportive pillow can help keep the body in the correct position throughout the night. A suitable pillow provides a slight tilt to the body without causing discomfort and supports reducing pressure on internal organs. Additionally, adjusting the height of the bed frame can enhance sleep quality, especially in addressing respiratory and digestive issues. Sudden movement upon waking, risks and safety solutions. In addition to sleep posture, another factor that significantly affects the health of older adults is the sudden movement upon waking. Sudden changes in body position can cause orthostatic hypotension, also known as low blood pressure, when standing up, which occurs when blood pressure drops quickly when transitioning from lying down to standing. This can lead to dizziness, lightheadedness, and in severe cases, the elderly person may fall and break bones. Orthostatic hypotension is a common issue among older adults because the circulatory system no longer functions as efficiently as before, causing blood to fail to circulate properly to the brain when changing positions. This makes older individuals more prone to dizziness and imbalance when standing up, significantly increasing the risk of falling and causing bodily harm. Safety recommendations when waking up. To minimize the risk of sudden movements upon waking, older adults should take a few simple but effective steps. Before standing up, they should sit on the bed for a moment to allow their body to adjust the position change and help stabilize blood pressure. Drinking a small glass of water before getting out of bed can also help the body feel more alert and reduce dizziness. Additionally, using a nightlight and ensuring the surrounding environment is safe around the bed is important. Night lights help older adults move around in the dark without tripping. At the same time, the bedroom should be kept tidy, with no obstacles in the way to reduce the risk of falling when waking up during the night. Snoring and sleep apnea. Causes and health implications. Snoring and sleep apnea are two issues that can be related to sleep apnea, a common respiratory disorder in older adults. Snoring occurs when the tissues in the throat vibrate as air passes through, producing the characteristic sound. The cause of snoring may be due to upper airway obstruction, where the tongue and muscles in the throat relax and block the windpipe while sleeping. While snoring is not always a sign of sleep apnea, if snoring occurs frequently along with pauses in breathing during sleep, it can be a clear indication of sleep apnea. Sleep apnea occurs when the body temporarily stops breathing during sleep, lasting from a few seconds to a few minutes. This phenomenon can happen multiple times throughout the night, preventing the body from getting enough oxygen while sleeping, leading to respiratory, cardiovascular, and neurological problems. People with sleep apnea may wake up multiple times during the night without realizing it, causing daytime fatigue, difficulty concentrating, and irritability. Impact on cardiovascular health and stroke risk. One of the most serious risks associated with sleep apnea is its impact on cardiovascular health. Each time breathing is interrupted during sleep, the body responds by stimulating the sympathetic nervous system, which raises blood pressure and heart rate. When this occurs repeatedly over time, it can place strain on the heart, leading to serious issues such as high blood pressure, arrhythmia, and even stroke. The oxygen deficiency in the blood caused by sleep apnea can reduce the amount of oxygen supplied to vital organs, such as the heart and brain. This increases the risk of cardiovascular diseases and stroke, especially in older adults who already have existing heart health problems. Each time breathing stops, the body not only lacks oxygen, but must work harder to compensate, creating a vicious cycle that increases health risks. Daytime fatigue and its impact on quality of life. Daytime fatigue is a common symptom of sleep apnea. When sleep is not deep and continuous, the body does not have enough time to recover and regenerate energy. As a result, people with sleep apnea often feel tired and low on energy during the day. This can affect their ability to focus, work efficiently, and perform daily activities. Furthermore, sleep apnea can lead to psychological problems such as anxiety, depression, and stress. Patients may feel worried about their health, leading to increased stress and reduced quality of life. Therefore, treating and improving sleep apnea not only helps patients feel healthier, but also enhances their overall quality of life. Improvement solutions. Sleeping on the left side and maintaining a healthy weight. One of the effective measures to reduce sleep apnea is adjusting the sleep posture. Sleeping on the left side is recommended for older adults because it helps reduce pressure on the respiratory and circulatory organs, improves blood circulation, and reduces the risk of airway obstruction. Sleeping on the left side prevents the stomach and intestines from pressing on the esophagus, thus reducing the risk of acid reflux, which is one of the causes of sleep apnea. In addition to adjusting the sleeping position, maintaining a healthy weight is also a critical factor in reducing sleep apnea risk. Being overweight or obese is a key contributor to sleep apnea, as excess fat around the neck and respiratory organs can put pressure on the airway, hindering breathing. Maintaining a healthy weight not only helps reduce sleep apnea, but also brings many other health benefits, including reducing the risk of cardiovascular diseases, diabetes, and high blood pressure. Recommendation: consult a doctor and timely treatment. If older adults experience symptoms such as excessive daytime sleepiness, shortness of breath, or loud snoring, they should consult a doctor to identify the cause and receive appropriate treatment. Doctors may recommend tests such as sleep monitoring, blood oxygen levels, or treatments such as using a CPAP machine, continuous positive airway pressure, to keep the airway open during the night. Risks when using medication: negative impacts on respiratory and circulatory systems. Another issue related to sleep and health in older adults is the use of medication before bedtime. Sedatives, sleeping pills, and pain relievers can weaken the respiratory and circulatory systems. These medications can prevent the body from maintaining stable breathing during sleep, increasing the risk of sleep apnea and cardiovascular problems. Sedatives, when used incorrectly, can overly suppress the central nervous system, reducing the body's ability to automatically regulate breathing while sleeping. This increases the risk of oxygen deficiency in the blood and places strain on the heart, leading to serious complications. Recommendations: consult a doctor and monitor blood pressure. To minimize risks when using medication, older adults should consult a doctor before using any medication, especially sedatives and sleeping pills. The doctor can help assess their overall health and provide safer medication options. Additionally, regular blood pressure checks and monitoring of health indicators are crucial for early detection of circulatory and respiratory issues. Sleeping in a room that is too hot. Negative impact on health. Room temperature significantly affects the quality of sleep and our health. Sleeping in a room that is too hot can cause various health problems, especially for older adults who may not regulate body temperature as effectively as they did when younger. Research indicates that excessively high room temperature can overload the heart, increase heart rate and blood pressure, which could lead to serious cardiovascular problems. Furthermore, in a hot environment, the body tends to lose water quickly, which reduces the ability to maintain the function of vital organs, including the heart and kidneys. High room temperature can also disrupt sleep cycles, preventing deep and restorative sleep. This is particularly important for older adults because insufficient sleep means the body has less time to restore physiological functions, leading to fatigue, reduced immunity, and increased risk of chronic diseases. An uncomfortable sleep environment can also cause frequent waking during the night, leading to stress and reduced quality of life. Additionally, inadequate deep sleep increases the risk of respiratory problems, such as sleep apnea and cardiovascular diseases like stroke, as sleep deprivation increases stress on the body and causes imbalances in vital functions like breathing and blood circulation. Recommendations: adjust room temperature and sleep environment. To improve sleep quality, especially for older adults, one important measure is to maintain the room temperature between 18 degrees Celsius and 22 degrees Celsius. This temperature helps the body maintain stable temperature regulation, promoting deep and restorative sleep. Using lightweight, breathable fabrics like cotton or linen can help reduce the feeling of heat and keep the body dry throughout the night. Furthermore, to ensure the air in a room remains fresh, older adults should pay attention to proper ventilation. Opening windows at night or using a fan to circulate the air is a simple but effective way to maintain a comfortable sleep environment. Late night eating risks to cardiovascular and digestive health. A bad habit that many older adults often fall into is eating late at night, especially heavy meals right before bed. This habit can lead to many serious health issues, including high blood pressure, irregular heart rhythms, and an increased risk of heart attack or stroke. The reason for this is that when we eat late, the body has to work harder to digest food, which causes blood pressure and heart rate to rise. In particular, eating fatty, hard-to-digest foods before bed can cause gastroesophageal reflux, GERD. When the stomach cannot digest food in time, stomach acids in food may flow back into the esophagus, causing a burning sensation and difficulty breathing. GERD can disrupt sleep and lead to respiratory problems, especially in those with sleep apnea or other breathing issues. Furthermore, late-night eating can cause oxygen depletion during sleep because the digestive system takes up energy, reducing blood circulation and oxygen delivery to vital organs. This not only increases the risk of cardiovascular diseases, but also lowers the quality of sleep, leading to fatigue and a decline in overall health. Recommendations: healthy eating habits and meal timing. To protect cardiovascular and digestive health, older adults should avoid overeating and fatty foods in the evening. It is advised to eat dinner at least 3 hours before going to bed to give the body time to digest the food. Additionally, opting for light, easy-to-digest foods such as salads, vegetables, or mild soups can reduce pressure on the digestive system and help stabilize blood pressure and heart rate. Older adults should particularly avoid foods high in fats, spicy foods, or foods containing stimulating spices, as they can increase stomach acid and cause reflux. High-fiber foods, such as whole grains and leafy greens, will support digestive function and help maintain stable heart health. Drinking too much water before bed. Impact on sleep and health. Drinking water is a good health habit, but consuming too much water right before bed can lead to various health issues, especially for older adults. Drinking excessive amounts of water before sleep can cause individuals to wake up multiple times during the night to use the bathroom, disrupting their sleep and reducing sleep quality. Frequent awakenings can lead to fatigue, lack of alertness during the day, and a decline in mental health. Moreover, waking up to use the bathroom at night increases the risk of falls and injuries, especially for individuals with weak health or balance and walking issues. This habit can also increase stress on the cardiovascular system when the body is forced to wake up and move during the night. Recommendations: adjusting water intake during the day. To avoid this, older adults should drink enough water during the day, but limit water intake in the 2 hours before bed. Drinking water regularly throughout the day helps maintain hydration levels and reduces nighttime thirst. If possible, older adults should focus on drinking water during the morning and afternoon, and avoid consuming large amounts in the evening. Additionally, to reduce the risk of falls and improve overall health, older adults should ensure that the environment around them is safe when waking up at night. Providing adequate lighting in the bedroom and walkways is an effective way to minimize the risk of falls during the night. Conclusion: small changes in daily sleep habits and lifestyle can make a significant difference in improving health and reducing the risk of serious health issues. Maintaining a comfortable sleep environment, such as keeping the room temperature balanced and using breathable fabrics, helps the body maintain a stable temperature and supports deep sleep. Healthy eating habits, including light dinners and avoiding late-night eating, will reduce pressure on the digestive and cardiovascular systems. Additionally, adjusting water intake before bed to prevent sleep disruption is crucial. These simple adjustments can help older adults sleep better, improve cardiovascular and respiratory health, enhance quality of life, reduce the risk of disease, and promote overall well-being.